Now, this is an example. This is an example of my dedication. Here's a young lady who is from our community, was educated in the city of Mount Vernon, and is doing a terrific job in city government. That's the example. That's the example of our young people in the city of Mount Vernon. This year, the Youth Bureau provided mentoring, tutorial sessions, workshops, and assembly programs for youth and their families. Through a number of initiatives, including the Mount Vernon Strong Program, Step Up, Intergenerational and Aspire programs, youth employment and career development programs, the Youth Bureau has connected hundreds of children to services to engage them in positive activities. I want those members of the Youth Bureau who work with us every day. I want you to stand up. I see them. Come on, just stand up. Thank you. Thank you. Thank you. Thank you. They work every day for our young people. I thank State Assemblyman Gary Pretlow and again Legislator Williams for their commitment to our young people. We cannot do it without you. And of course, we can't do it without your money. I am also pleased and proud to report that my Youth Empowerment Council traveled to Washington, D.C. for a tour of the White House and the Capitol building. Again, just thank you so much, Youth Bureau. You work so hard in your commitment to our young people each and every day. Our Recreation Department also expanded programs last year. Deputy Commissioner Rasul Salahuddin and his staff he didn't get that much applause when he played basketball. The Recreation Department has been busy marketing existing programs and developing new programs for families. The department expanded computer, educational, and sports programs for youth, as well as adding a variety of programs exclusively for adults and seniors. Also, last June, thousands attended Mayor Young's City Fair held at Memorial Field, even though it rained every day. We have worked very hard to ensure that the fair was family-oriented and affords people the opportunity to have fun close to home. I would like to thank Deputy Chief of Staff Hank Miller for making the fair a major success. My plan to improve and increase Mount Vernon's recreational opportunities and options for our citizens doesn't end with Memorial Field. This year, Brush Park, which is the home of the Mount Vernon Little League, will see major improvements that will modernize this field and bring it into conformance with National Little League standards. We are also beginning the process of creating a premier tennis facility at Hutchinson Field that will not only expand the tennis opportunities for our residents, but also attract more people to our city and allow Mount Vernon to host USTA level tournaments. For our seniors, we are partnering with the county and other agencies to deliver as many services to you. I would like at this time to recognize Deputy Commissioner Rasul Salahuddin. We've had some major successes last year, but many challenges lay ahead, including preserving our hospital. This week, Congress passed President Obama's landmark health care legislation. Despite this historic event, health care continues to be a major concern to me and to this community. Last August, I sounded the alarm that dramatic changes were afoot at Mount Vernon Hospital. That's when I then launched a campaign to save Mount Vernon Hospital. Last year alone, and listen to these statistics, last year alone, Mount Vernon Hospital served over 26,000 patients through the Family Health and Wellness Program. Also, and in addition, Mount Vernon Hospital also treated 22,000 in the emergency room, as well as provided inpatient care to thousands of local residents, many of whom are uninsured. The hospital is affiliated with South Shore Medical Center in New Rochelle, which had proposed to reduce staff, inpatient beds, and shift major services to New Rochelle. I vehemently believe that Mount Vernon Hospital is worth saving. My office launched a petition drive, conducted town hall meetings and rallies to stop the dismantling of Mount Vernon Hospital and restoring its vital services. My office partnered with labor unions, hospital staff, and members of the United Black Clergy to fight to keep Mount Vernon Hospital as a primary care facility. I want to thank all those who signed the petition, attended the rallies, and stood with us. We are now at the table because of this. We are at the table demanding more community input about the future of our hospital. Mount Vernon deserves the best. Also, on the healthcare front, you may have noticed a new ambulance driving around our city. Last year, we entered in a contract with TransCare Ambulance Corporation. This was a no-brainer. After numerous complaints about ambulance service in our city, we looked around for a company that would meet our needs. Fortunately, we did not have to look very far. TransCare is based right here in Mount Vernon. They hire Mount Vernon residents and have 45 ambulance buses dispatched from the Fulton Avenue headquarters on a daily basis. Under the new agreement, Mount Vernon now has a dedicated ambulance. Long gone are the days of sharing ambulance service with other communities. This new relationship with TransCare bodes well for our overall emergency operations. Later this year, we will have a fully functional emergency operations center. This center, or if you want to refer to it as EOC, was made possible by U.S. Senators Schumer and Gillibrand. My Chief of Staff, Yolanda Robinson, has been working